to our Wednesday finance meeting. We're going to depart a little bit from the norm. But what we're going to hear today is, as everybody knows, the county has owns a nursing home facility, and one of the few that is still operating without a county subsidy. And on the basis of what we feel is necessary business approach to diversify our revenue streams and to get more Medicare patients and improve our mix of patients, county invested a considerable amount in the construction of a new rehab facility. The success of that effort, aside from the construction and the staff that are running, will to a significant degree depend on our ability to attract patients and residents to that facility, and that requires marketing. So our folks from Claremont, along with our communications team, have developed a strategy, and that's what we're here today to talk about. Clearly, again, to the extent that this strategy is successful in conjunction with our pricing and with the quality of care that we provide, will give us a greater chance to achieve our goals for the rehab project and for CNRC in general. So, without further ado, to whom should I turn this over to? That was Heather. Barb who raised her hand.
Hi, Barb.
Hi.
First, I want to say this was a collaborative effort between the communications team and the folks at Claremont, and I'd like to thank Megan Silverstrom, Chris Seacrest, and Helen Schultz for their hard work. And I would also like to acknowledge the input by Dana Best, our Director of Finance, and also the folks from Premier. And with that, I'll turn it over to Megan to review the PowerPoint presentation.
Okay, we're just going to walk you through kind of a mission statement that we've come up with, some goals from marketing. A lot of this is going to be in the short term as we're trying to market the opening of the rehabilitation center, but a lot of these goals we're going to carry into a long-term marketing strategy. We have done a little bit of branding, and Chris has done some logo work, naming the facility, the new facility Transitions at Claremont. So that's the logo that we've come up with for you to see there. Came up with a mission to maximize the marketing dollars to positively impact the Medicare short-term bed count in the rehabilitation unit while continuing to promote the Claremont Nursing Rehabilitation Center as a community-based skilled nursing facility. The first goal we set was to reach potential clientele to aid in the rehabilitation unit goal of 18 Medicare bed increase over 2 years in the rehab unit and for an average of 32 Medicare beds occupied. We're going to measure our first goal by looking at the numbers that are tracked daily by the CNRC staff and data provided in monthly reports to Finance and Board of Commissioners to make sure that we are doing work to try to provide for that goal of the rehabilitation unit and the CNRC. Our second goal is to maintain visibility and continue to build on our relationships with established referrals while also continuing to grow our referral relationships in other areas. This is one of the areas that's really important to CNRC to kind of get their clientele, so we really value this one. We're going to measure that by tracking the number of patients that are referred to CNRC by each of our referral sources. We're going to look at the referral source's willingness to meet the CNRC marketing representative on a regular basis, their willingness to display their marketing material, and we want to routinely examine their organization's clientele base to determine whether it's still relevant to CNRC's mission. We don't want to be going out to a former referral and trying to get business from them when they're no longer serving our clientele base. So. Our third goal was to maximize marketing dollars to reach our identified target audience in geographic regions. We're looking to reach the 35 or 65 plus community along with 35 to 60-year-old decision makers. We have historically looked at target areas of the Carlisle and West Shore, and we will, to measure this, we will utilize surveys that are given to folks when they come in as part of the application process to find out how they discovered CNRC. And we're going to get analytical reports from several of the vendors that we're going to be using for marketing purposes.
So, question?
Yes.
Does that mean we don't care about Shippensburg?
Goal 4.
Love?
Goal 4. Explore new marketing area in Western Cumberland County and Northern Franklin County. We've discussed extensively that we think that there is those two areas that there's some potential there, and we'd kind of like to dip our toes in the water in those markets and take a look at building referral relationships down there as well as doing some advertising with a few vendors. And We're going to identify and solicit new referral sources in this region, and we'll track those referral sources on a quarterly basis, much like we would our normal established referral-based clients, and assess if we're getting any clientele from that region, and decide if we should maybe kind of expand our marketing down there and grow that program down there. Our short-term marketing strategy, we have a few to go through here. The first is going to be the opening of the rehab unit. There will be 2 launch events, one of which will be a public opening, a daytime event open to the public, some type of ribbon cutting ceremony. And the other event will be an event for our referral folks to come in, exclusive access for them, and really kind of get a hands-on feel of the rehabilitation unit, as well as get an opportunity to mix with staff and talk to folks.
Can you give us some examples of where referral sources are?
Helen, I'll defer to you on that.
That would be the 5 hospitals in our area, orthopedic doctors, family doctors. Basically, that's where referrals come from.
Healthcare providers.
Yes.
And the 5,000 to 6,000 is what you're looking at to spend for that event?
Yes.
Okay, seems a little high, but go on.
Okay. The next thing that we've looked at, we met with Comcast to discuss doing some commercial spots versus when we were looking at our local stations to do some stuff. And we're going to go through a few slides here that we find Comcast to be a much better option and focus on what we need. What we're looking to do right now in the short term to promote the rehabilitation unit is a 2-week campaign running from mid-December to January, which will feature the rehab unit, and we're going to get 645 spots on Comcast, through Comcast for a price of $2,761. The good thing about going with Comcast is 100% of our investment into cable television goes to reach our demographic target area. It will specifically just go to televisions in the West Shore area, in the Carlisle area, wherever we pick. If we went with our local stations, only about 25% of our ideal market will be reached with our investment. So that right there was really kind of an eye-opener for us as to why Comcast would be a better option. Comcast presented to us, we gave them the demographics that we were looking to target, and they gave us this information that, folks in the 65 plus demographic spend 58% of their time consuming media TV online, but the TV piece, which is what we're looking at right now, is 58%. So that's where they consume most of their media, so we're able to hit a large target of them versus going with online radio or so forth. The 35 to 64-year-old market, we're able to hit 47, and if we decide to do some online with Comcast, that would increase as well. But it's again showing us that this is a prime media to be able to get to our target audience.
So in other words, the best way to go is Comcast, so says Comcast.
Yes. Those were the numbers that they gave us as far as, that's what they presented us. Because they were able to show us that we can hit our target market. It will only go to television.
Well, there are a lot more numbers than just what they're showing you that matter, but that's not your fault. I'll have more to say on it.
The other thing that Comcast is able to work with us on is based on the demographic that we gave them. They can identify the target stations or channels that folks in that area will consume, and that's where our television ads would air. So, and they're going to air, on a 24/7 basis. The breakdown's kind of there, and the demographic that we're looking to hit, those are the stations or the channels that we would want to capitalize on. We're also looking to do billboards. We've met with a vendor to look at doing 5 static billboards with a coming soon kind of theme that I think actually in your handout you can see an example of the billboard. This is the next slide, okay. 5 static billboards will run us about $4,100 for a 4-week campaign. We're looking to do that in the West Shore area. We did look at digital billboards, but for that amount, we get less billboards. So we wanted to be able to kind of flood the market and go with static billboards. And this is what we had come up with as possible artwork to send to them. The benefit of going with billboards, they're designed to reach a mass market, and we're able to put them in multiple locations. And outdoor media has the lowest average cost per 1,000 views of any media that's out there, with the highest exposure rate, which is 20 hours a week for folks traveling and things like that. And that came from not the billboard vendor itself, but an online source through polling. These are the locations that we were looking at to deploy in the West Shore area, and 1 or 2 of those are near some of our referral sources, so we thought that was a nice opportunity to be able to put that there. The referrals, we're going to continue.
Could you just back up to that? I can't, it's a little small for me to read that.
State Street.
I guess I gotta get my eyes checked.
Yes.
I'd be interested in seeing exactly where these locations are.
We have, that we can share with you from the vendor, and they actually have screen or snapshots of the locations with the actual billboard available, so you can see the location. But these are ones that we kind of discussed with him, and,
Are these digital, I'm sorry, or are these static?
they're static. They're static. We had the option to look at digital, and that still is an option, but we get more billboards for less money with static. And the thing that was pointed out to us with static is it's not rolling, so we aren't competing with someone else flashing up for a 30-second period.
Right.
It's always us. So we liked the idea of that and just thought that that was a better financial option. Sure, the digital looks nice, but for what we're trying to do right now, I think static was our best option.
The digital also allows you to update
Yes.
and modify your content.
And that decision is the correct decision.
Yeah, long
For
term.
them.
Long term, we would like to be able to be, a little bit, change things up.
And then I read that 5 are illuminated and 2 are not.
I'm sorry.
5 are illuminated and 2 are not.
Yes. 5 or?
I mean, I'm sorry, 3 are illuminated and 2 are not.
They may not be. He did not mention that to us, so that's something we'll have to look into. Okay,
I'm on slide 16,
Yeah, I see it.
and I'm seeing
And we
that
can-
3 say yes on illumination and 2 say no.
That's one of those things too, where we can give him a call. I don't know if they're in certain areas, that there's a lot of natural commercial lighting, that those are just lit up areas, but we can request to have those changed, certainly. These aren't set in stone. I mean, these were options that he gave us that we thought were pretty good options. Referrals, we're going to continue to do, referral outreach and really kind of promote, which Helen has already been doing, but she's going to continue to do, promote the new rehabilitation unit. And she has started to make contact with new referral sources in western Cumberland County and northern Franklin County, looking at some of the family practices in the Newville area and Shippensburg area, as well as the whole Summit Health campus that's in Chambersburg, their hospital and all of their partner family doctor physicians that are out in that region. She's going to start making contact with them and providing marketing materials, not only to those new folks, but also the folks in our areas, because Chris has already created some stuff to let folks know what they can expect when this unit opens. Our timeline as of right now, if we go with Comcast, is to begin filming a commercial the 1st to the 12th, that would then air December 15th through January 2nd. December 4th, we would like to bring a request for approval to the workshop for a contract with a billboard vendor, and it would be another credit application with that billboard vendor, and then action to be taken possibly at the December 8th meeting. The billboard campaign would be December 22nd through January 18th, taking us very close up to the opening. And then December 15th to the 28th would run the Comcast spot as well. And then at some point, once we get better dates when this will open, we would be setting dates for the referral reception event as well as the open house event. Long-term marketing, we're developing a plan to bring before you as well. Again, it's going to be a lot of the same goals. It just might be a different strategy, a little bit more in-depth strategy in long-term. And we're going to hopefully take some learning experience from the short-term and try to analyze some of the data that we can pull from that to put into our long-term. But as of right now, we're looking into doing the Comcast spotlight and continuing that and expanding that to the West Shore area. Looking at, and we've met with some folks from PA Media Group about doing some online as well as print advertising. Continuing with referrals, as that's one of the most important things that I think we can do. Billboards, new website with utilization testimonials. Helen has acquired a bunch of testimonials from folks that have had families stay there or have stayed there themselves. And with the hopeful launching of a new county website, we'd like to do something to kind of put CNRC and a new rehab unit out there and give them a little bit more publicity. as well as Chris is looking to do and has started working on doing a virtual tour so that somebody can go on the website and get a virtual tour of the rehab unit and really kind of get the look of what a great unit it is and how new and innovative it is. So we're going to be looking to do that as well. And that's all we have.
So I think Barb raised a question about the cost of the VIP events. Maybe we could go into that in a little detail.
You just want me to recap what we're kind of thinking for that? Okay. That would be more of an event where we would have, there would be food and beverages and things like that. It would be a little bit more of a grand event. We would expect a high attendance to bring all our referrals in. It would be a formal reception for them to come in and kind of see, look, feel, touch, talk to folks. One of the things we are looking into, just through some conversations with the solicitor, there's nothing solid yet, but we were looking at some of the vendors that work with CNRC to see if they would be interested in hosting the event and doing some cost sharing for the event as well. So we're exploring that option so that we wouldn't necessarily have to take on the entire burden of cost.
You talking about pianos and candelabra? You talking about ice sculptures? What are we talking
No
about?
ice sculptures. something that is on a nicer scale and something that is, a formal reception where we would have hors d'oeuvres and things like that for folks to come in. Something in the evening hours, not too elaborate, no ice sculptures. Helen had contacted a harpist or something like that, just to have those folks come in and have a special opportunity to take some time in the rehab center.
So, first of all, I want to thank you for putting so much effort into all this, and I appreciate what you've done so far. What's our date when the new rehab unit is actually going to be serving patients?
Mid to late January is the estimate.
Okay, so
I think the last time we spoke to the last update from John and I heard put it somewhere around the end of the second week, beginning of the third week of January, which is about what Helen said.
Correct.
So we are on a short time frame here in terms of, starting a promotional effort, and I can appreciate that. The transitions, naming, did that, we just came up with that, or how?
We
did that-
polled our county, Claremont employees and staff, and then we took those names to our team, and we pulled the name we thought best suited.
We really liked transitions. We thought it displayed what you're doing when you come to a short-term rehab unit. It's a transition period between you getting back to your, typical normal functioning period in life. So we liked what that represented, and that was something that was brought forth by a staff member, and it's the one that we thought was appropriate.
Okay.
Have you checked for any trademark restrictions?
I'm sorry, I did trademark. I didn't consider it a trademark.
This again was just, we brought this before you guys to kind of take a look at it. It's not definite solid, but we'll definitely do that research.
And I'm not sure whether or not Heritage Harbor had ever gone through that either, and that's a good point.
We can engage Keith.
Absolutely.
You'll probably find this somebody else.
Now, on the Comcast, and I understand that, and I'm glad you considered and talked to Comcast, because you can, instead of like advertising with one of the large commercial television stations, which essentially serve areas
We're not in
well
this.
beyond, our target area. I think this makes sense, as part of the effort. What does the Carlisle zone mean? Because that's, you're talking about initially at least starting the Carlisle zone on Comcast.
They break down, as we have the map in there, they break it down into different zones, and it would be additional cost to go into the West Shore area. So in the West Shore, Carlisle area, we can do stuff down in the Shippensburg area, but they have it broken down in their maps there if you want to take a look at it. And that's how they build, that's how they do contracting, that's how they determine how they're going to deploy it to what customers are going to deploy to.
So the 2,700 is only for the Carlisle zone.
Only for the Carlisle zone, that's correct.
Yeah, and, part of the reason why it probably costs more to advertise, because that's when most, on the West Shore, that's where most of the people are.
I think it's about $2,000 more in the West Shore area to do that for the short term. We would like to expand into the West Shore for long-term marketing, but for the short-term plan, with the budget that we were given, we thought the Carlisle would be a great place to start with Comcast, to see how it goes, and start with the billboards in the West Shore. And I think we picked the West Shore area because of the referral sources that are in that area. That's where you see a lot of Holy Spirit, Pinnacle, stuff like that. Those sorts of referral sources for us, so.
Maybe it's just me, but I don't know how much benefit you get out of billboard advertising. So I'm concerned about that. The other thing, are we printing up any kind of literature?
Yes.
And one of the things that I think is missing from this is, would not be that large of an expense, would be to have a brochure that outlines the benefit of the open and new rehab, but also includes that information, testimonials and so forth, with respect to folks who, are normal residents at the nursing home. And what I thought is those kind of flyers, brochures, or whatever, if we can get the agreement of, healthcare providers in the area, doctors' offices, and also at all of our hospitals, to have them available and sitting out, on the counters or whatever, or, in the lounge areas of those places.
We have those created. We have not, until we kind of get definite that we're going to go with transitions, we haven't
Okay.
transitioned from there, but Chris has those created. She's done a lot of work with ones that are specifically for CMRC for the rehab unit, and Helen has already started to take those out. And that's why we kind of put one of those, in our one goal about going out to referral sources, one of the measurements needs to be the referrals that are willing to take marketing materials. We need to make sure that we're continuously getting them into their hands.
But a lot of people wait for an awful long time, all those doctors'
Absolutely.
offices.
And Helen has been taking those materials out there.
And then, of course, the other thing I have thought of is we could do some direct mail to the target population. So, and I know that a lot of people are, online, even seniors are, online. I understand there's also still an awful lot of older folks who, are not engaged in social media and web and all that. So I think we need to keep that in mind too. I understand you also want to get to the younger family members who are thinking about, thinking about their parents and their grandparents and that. But by the same token, I think you also need to target the potential users of the facility too. So.
And actually, Jim, we have considered sending out a mailer as well.
We've been a little,
We've done pretty quickly.
I think we talked about possibly doing a mailer announcing the opening. We've had a little bit of concern with mailers because they are expensive, not only to produce, but then to mail themselves. And we discussed that unless this is something that at that moment that someone receives their mail or that they're looking for this service, we're fearful that it's going to be something that's pushed aside and not necessarily given a lot of attention. And unlike some other, type services that might be marketed. So we looked at that and kind of decided that that's something that we could potentially look at, but it's not necessarily one of our top priorities of marketing.
How much are we proposing to spend on the billboards again for studying here?
4,500.
And that's for 4 weeks?
That's for 4 weeks.
Okay.
And again,
And that's, what I'm looking at here is it's for, at about, what is that chart? 1, 2, 3, 5 locations?
Yes.
And what would it cost us to do, ads in the West Shore on Comcast?
I think it's in the range of 45 or 47.
24.
Yeah.
I'd like to maybe see us, expend dollars on Comcast ads instead of.
Based on what? Based on what?
I don't know, Gary, do you want to say something about that?
Oh, finish your thought.
All I'm suggesting is that I don't know how beneficial, billboards are, just my opinion. But, no, I haven't conducted a costly study into this yet, no, I haven't. I do think it's important that we move forward with the promotion of this new facility as soon as we can. So, unfinished.
Okay. I'm going to weigh in here a little bit. I asked that question for a very specific reason based on what. And the point of the matter is these decisions need to be undertaken. And let me preface this by saying, nothing that I say is intended as a criticism of you folks. You've done a marvelous job of putting together something here virtually overnight. Because roughly 4 weeks ago, we were all sitting around here looking at each other, asking the question, how are we going to handle marketing for an institution that was set to open in roughly 2 months? And that is a position that we shouldn't be in and that you never should have been put in a position of having to bail us out of. So this is not aimed at you, but there are some serious concerns I have here. Aside from the fact, and I've spoken to this before, the project has been pursued as an incredible roll of the dice to begin with. Marred by a lack of market planning and business planning to a breathtaking degree. And that even was possibly salvageable if we turn out the right type of marketing at the right time in the right way. We are, after all, competing with other rehab facilities for customers, and customers is what it's all about. They're going to generate the revenue, and the revenue is why we supposedly are doing this. What you've produced here is very interesting. It is without trying to sound insulting about it, it looks like a real plan, but the point is it's not a real plan, and it's not for the simple reason that there's nothing behind it. It's not based on appropriate research, it's not based on appropriate testing. We don't know the answer to the question I asked a while
So
ago.
we should spend a couple $1,000s.
No, Frank, this is
not a couple thousand. We should probably spend thousands of dollars on another consultant.
No,
That's what
here's the
you're saying.
deal. That is not what I'm
That's
saying.
exactly
Do not put
what
words in my mouth. But the point of the matter is, if this had been planned sufficiently, there is absolutely no reason a marketing budget, which is the centerpiece of your success in this, and we are gambling a heck of a lot on this, of the county's finances, and that's what it is. It is a gamble. But we are gambling that on the ability to market. There is absolutely no reason, none whatsoever, that a marketing budget shouldn't have been built in to the borrowing for the construction of this project. Marketing is a key aspect. It's not an add-on, it's not an afterthought. It needed to be pursued for the last 7 or 8 months, or whatever, the 6 months, whenever the bonds were floated. If we had a business plan at the time, at least the marketing component would have been on the radar and would have received attention at some point before 4 weeks ago. These people have done a marvelous job trying to pull something together out of nothing. But candidly, this is outside of your area of expertise. And as I said just 4 weeks ago, we need some professional assistance on this. It should have been built into the budget. It shouldn't have any impact on the general fund. But it wasn't planned that way. But at the same time, there's an old saying in business, you got to spend money to make money. Well, more than any other function that we as a county government undertake, this is a business. We are in competition, we are seeking customers. You have to spend some money, and you have to spend it wisely to make money. You can't get it on the cheap, and that, unfortunately, is exactly what this looks like. And I'm speaking as somebody who has 20 plus years working in ad agencies and working directly with ad agencies. So, and I would not presume to try to sit down and construct this on my own, even with the background that I have. So you folks have been put in a very tough position. So now we have to go forward with what we have, and that's an unfortunate situation that we have. But I think cutting corners on this is certainly not the way. It certainly is going to just put you closer to assurance of a failure in this project. And the county cannot afford to fail this project. We're so far along now, we're counting on this revenue to bail out the nursing home, even though there's no business plan that tells us how much revenue it's going to generate, how we're going to pay back the bonds, and whether the remaining money is big enough to fill the gap to keep this thing afloat. And that is the fault of the Board of Commissioners, quite frankly. They're not demanding that type of due diligence before agreeing to a $5 million bond issuance. The least we can do now, because we're this far along, is ensure that our team here has the tools they need to market this thing effectively and sufficiently for it to to be profitable. And that is what it needs to be. It needs to be profitable. So they don't have those things right now. We're taking a shot in the dark, and what was simply a roll of the dice now is a very troubling roll of the dice if we don't have the correct approach to marketing this facility. At the very least, you need a media plan, because I'll just reiterate, Comcast absolutely says they're the best, and they're going to show you the numbers that are best. You want a media planner who's going to go get standard rating data and compare them to everything else. Do we even ask the questions about how many of their subscribers are on the $10 senior plan versus how many have the full package? We don't know. And I don't blame you guys for that, because you shouldn't be expected to know the right questions to ask with Comcast. They are salespeople. Just as Channel 21 and Channel 8, when they came into us, are salespeople. I have no doubt that cable will be a very valuable tool to this. And Jim, thank you for suggesting them at the time we were talking to the networks, because it is a better tool, but you have to use the tools correctly. And my question, again, regarding the billboards, is we simply don't know. And we don't know because the research isn't there to back this up. We need that. We need to give these people the adequate resources so that they can come up with at least a fighting chance for this project to succeed.
So I just like to ask anybody and everybody who's driven past more than 2 or 3 billboards in the last 3 months, 6 months. Who do you see on the billboards? Pinnacle, Holy Spirit.
Marble Life.
You got hospice stuff, you got home care stuff, healthcare's all over the place. Okay, that's anecdotal. I grant you that. But that's where all the big people with all the big money are putting their resources. Now, they probably have a lot more money and a lot more variegated plan and a lot more things going, but we don't. And I think it's okay to be up on the same medium. I think it's a good idea to be up on the same medium with not only Pinnacle, the hospitals, who's a referral source, but also with the people that we compete against.
I'm not saying that billboard necessarily are the worst way to go. I just don't think that they're the best. And the fact of the matter is, I do know that people watch TV on the West Shore. And I'm just suggesting that instead of, for some reason, we've decided that the immediate Carlisle area, the zone, should receive television.
For the opening event. Long term, I think and correct me if I'm wrong, okay? The focus for the opening event, which is going to physically take place in the Carlisle area, is the Carlisle area. Long term, which is really your success. The opening is the opening. So Helen, I'm going to ask you in a second, what percentage, what's the breakdown in terms of our admissions from our referral sources versus what we would call walk-in traffic that maybe saw something through an advertisement? But hold off on that just for a minute. So I think what the notion is, promote the event locally in the Carlisle area where people are most likely to come. With the VIP event for our referral sources, most of them are on, I think, the West Shore. Okay? That, as well as we have people, Carlisle Regional, so that seems to make sense to me. The longer term stuff, I think, clearly has to be distributed where we have branded a primitive notion of our demographics, but I think one that's more or less accurate, which would mean moving more into the West Shore, less into Carlisle, and looking to the southern part of the county as kind of like, let's see if we can do that. Let's see who we're competing with. Franklin just sold off their county facility. Maybe that creates an opening there for people who like county type facilities. I don't know. Okay, so I think this is a spunky plan. We can look at it either deficient or we can look at it spunky and bold. On the other hand, we're not pissing away a massive amount of money on a media buyer or things like that have to be done on a grand scale.
Media buyer works on a commission basis. Generally,
And you know what the volume of advertising that you have to place to make that commission up? A lot more than we have
Depends on which
to
one.
pay.
That's not true.
Well, that's what my research showed. Anyway, so
80/20.
80% from our referral sources, which are healthcare providers, to 20%.
Word of mouth.
Word of mouth, which would include advertising, okay? if that's the way it is, I don't think we're seeking to shift that. What we're just trying to do is milk the wells from 80%. The more money that we focus on that 80% is, I think, where we're going to get most of our returns. The other stuff is important as a reinforcing mechanism, but the main thing is that 80% from the referral sources. So whatever we do on the grand scale should reinforce that, but it's supplementary and complementary.
All right, well, in that case, and I'm not surprised the 80% is from the referral sources, but here's a key question. How are you differentiating? Where are they referring to now, and what is it you offer that's different, that they should switch from one source to your source?
Where the hospital's referring to now instead of us. The
The
competitors.
folks that you are, the healthcare professionals you're seeking
Yes.
to do referrals from, and currently doing, getting them from the nursing facility, they obviously are referring people already for rehab somewhere.
Right.
So do we know where they're referring them to?
We are one of 9 skilled nursing facilities between here and
I'm
Shippensburg.
talking about the rehab side, on rehab. Do we know where they're referring people to now?
Have rehabilitation services.
Right, the other skilled nursing
Your
facilities.
Yeah.
competitors.
Which ones?
Your competitors
Right.
for this venture.
Right.
Who are they? Where are they getting their referrals?
Oh,
And-
I'm sorry, I'm
Yes.
sorry. Yeah, Forest Park, Cornwall, the ones in this vicinity. They're
Okay,
getting theirs from the same referral sources. Yes.
okay. So they're geographically pretty much close
Yes.
together. All right, so we don't have a geographic advantage.
No.
What advantage are we going to sell to those physicians and other providers and say, stop referring over here, or at least add us as refer your people over here? What is our point of differentiation? Are we bigger, better, faster, cheaper? What's
I
our?
don't know the percentage, but not all of them have a separately housed rehab unit,
Okay.
the way we do.
So we are somewhat.
Yes. Some of them maybe have a separate wing, but it's just, it's a
We
joint.
even had discussions that Helen has pointed out, and this is something that I think we need to promote. When you get, the cost that you get for a day in Claremont's facility, there are a lot of add-ons that are included in that. Whereas if you go to some of these other facilities, the transportation, the, tissues, and all the little incidentals you're charged for. So that's something that sets us aside. We're not gonna keep billing you for that little
We
stuff.
are not a la carte nickel and dime.
Exactly. So new state-of-the-art facility, separate living quarters for those folks, but I think that's something else to hit on, is that we're not implementing.
High quality care, establish relations with referral sources, establish information sharing, cooperation, coordination of the efforts. We'll bend over backwards to make sure we find a space for your people when you need that space.
Absolutely.
What is the message that's going to be the 2 weeks advertising in the Carlisle area?
The message
What's
is,
the message? What's the spot going to say?
it's going to be that they're coming soon, and we're gonna hit on the points that it's separate housing, rehabilitation center, the services that they offer, the types of rehab that they offer. We have 30 seconds, I think, so it's not gonna be full of information, but it's going to be,
And why shouldn't we do that on the West Shore?
we were just looking to diversify how we were reaching out to people, so we could then look at what's most effective and try to do everything. And we had a budget that we were trying to stay within, so. We want
Well,
to-
I would certainly like to see the costs for that outreach to the West Shore on Comcast, and the reduction then, if the determination is that billboarding is not that most profitable, let's say, in the return on that investment, or a scale back of those billboards selected in those targeted areas, and perhaps some of that revenue going into Comcast on the West Shore. Can we get those numbers?
Yeah,
Absolutely.
Yes.
Yep, we have them.
I'm sorry?
Yes,
Yes.
sorry, we do.
okay.
I mean, can we get them in a timely enough fashion for our meeting on the 8th?
we have the costs.
Right, we have our printout for the West Shore grand opening on-air recommendation from Comcast.
And it is how much?
So it's 4624, so that with the 2761, that would be 9385 if we did Carlisle and West Shore.
And not did the billboards?
Correct. But that's out of our 15.
One digital billboard is $1,500 for 4 weeks.
Okay. So the question is, does it make more, the immediate question, in terms of promoting the opening, does it make more sense to use the billboards around here or to use the relatively similar amount of money to do the Comcast on the West Shore? Okay? I think that's a reasonable question. We can take a look at
Okay.
and report back first thing next week.
Yeah, and even if it's paring back some of these, now, see, we have one billboard you have located in Dillsburg, is that right?
Well, we get a fair number of referrals from them. I don't have a number for you, but there are no skilled nursing facilities or rehab outfits down there, inpatient.
So in other words, these are people who live in the northern New York.
Right, and
That's
they're,
why we
they and their
selected
families are willing to drive to Carlisle,
Okay,
rather than the other part of your county.
okay, so that's the rationale.
So I do have a question about the Comcast stuff. And my one concern looking at the dates is we're going to get swamped in the Christmas stuff. Will anybody be paying attention to us, or will they be paying attention to last minute sales at Best Buy, over the river and through the woods, and whatever else goes on?
If we are to open that unit the second week of January, we have to be out there. We're thinking a month before that.
Okay, but
So if
that
we-
also leaves us, again, assuming that this is a sensible, Comcast is a sensible thing to do. Our push, now, I'm assuming that's December 28th, or is that January 28th? It says December 15th to 28th.
Correct.
Okay, so that's going to stop a full 2-3 weeks before the event. And I'm thinking that if we started later and ran up to the event, given that it is an event that we're promoting, we want to keep that momentum up to the opening date.
Yeah, and I,
And we had just kind of selected that area not knowing the opening date, so.
Is there a difference in pricing for the dates that Comcast is airing?
I don't believe so, she didn't indicate that. I mean, those were, if you look at the numbers, and she gave us long-term numbers too, they're in line.
what is the Comcast spotlight? Because
That's what they call this piece that they do. I mean, it's,
Where does this air? What programs is it air? What time is it
it
air?
will air, it's all in that, and it's in here, it will air on the networks that they identify, folks in our demographic that we're hoping to reach. So it'll be Fox News, CNN, HGTV, there's a whole list there. And geographically, it just airs where we want it to air. So that Carlisle zone, Helen showed you that map of the Carlisle zone.
Yeah, no, I understand the geographic part. I'm just wondering, this is gonna
It airs
air.
throughout the day.
I'm sorry, but if we're trying to hit seniors in a predominantly politically oriented county that we live in, what better thing could you possibly do other than Fox News?
Well, and that's the highest one that we get the most commercials on.
So there's a method.
CNN and Fox
There's a
News.
method to it.
You
My
don't think
7-year-old
you don't think
watches
anybody
all
watches
day.
MSNBC then?
You're seven-
It's on there, but it's there now.
Your 7-year-old watches?
My 7-year-old dad, all he does is watch the news all day. Over and over and over again. But, I mean, and it does, those networks are the ones that we're going to get more commercials aired on, so.
Did we have that? Maybe that's in here.
There's the networks are on there.
It's on
Page
page
12.
Okay, giving you a more detailed media schedule than this, do you have any idea what timeframes they're going to be plugging that into? Do you have a certain?
That breakdown is in there, yeah.
That's all.
Oh, yeah, it is 6 A to 12 P, so I mean, it would be 30 spots running throughout the day.
As long as it's not past 8 o'clock at night, for when the early bird specials on, I think we'd be okay.
Who's working on the website?
We are, that's a collaborative effort with IMTO. We're currently getting guidance from Civic Plus.
And we would like to revamp, and we've discussed several ways to do it, but to make the CNRC website and the county website feel is a little bit of a separate thing, because we are trying to market this as a business, not necessarily as a county department. So we would like for it to possibly have its kind of a look and feel somewhat separate from the county website. So we're looking into that as we upgrade the whole county website.
Because if you're, in your mock-up of the ad, 1/4 of your prime visual space is the link to the website. So whatever you're trying to generate with that look and feel should be matched when they get to that site, so they realize, oh, I'm in the right space, place.
Helen, correct me if I'm wrong, but one of the things that we have that some of our competitors don't is the 7-day-a-week therapy, right?
We will, right now we have 6, but actually.
But when it opens, we'll have 7 days.
So that's something that we really want to market and get in our promotional materials. So you just had asked that question, and that's something that stood out in my mind that we have for our competitors.
I do think it's going to be important if you know, this 30-second spot, that, somewhere as a part of that, if we have this new website, Chris, that there are, going to be advertised as part of that spot too.
Well, and that's it.
So that people are looking for additional information, they know where to go.
And that's why we went with the website versus a telephone number on the billboard as well. People are more apt to sit at home comfortably and look at something rather than make a phone call and ask questions and send this out. So we decided to go with the website to get people to.
So I think one of the things that we need to do as early as possible is to get whatever data there is, and I know there is data, because I have a friend in the billboard business, but he doesn't work Central PA, so there's no conflict of interest. But there is significant data on the effectiveness of billboards, well, not only digital versus static, but left-handed side of the road, right-handed side of the road, going north, going south, major roads, whatever. There's all kinds of stuff. And I'm sure somebody has done some comparison between that and, again, and possibly for something as specific as an event as compared to an ongoing campaign. And I think if we can either show that billboard stuff is appropriate and cost effective for this, great. If not, then I think the question of taking that money and I think possibly looking at maybe taking a little bit more of that cost of the VIP event, maybe could be used for, if we find out if the data says that using Comcast on the West Shore would be a better way to do it. I think that's an option, but it's a decision we need to make quickly. And it should be based on some data. And that data is, I know is available.
Outdoor is a reinforcement medium. It should echo your other vehicles, your other communications vehicles, simply similar to jot people's memories.
Well, I think you've done a good job putting together at least, any marketing campaign, that's going to be ongoing for a while. It's going to have revisions, to it. So this at least gets us started. I think we have a wonderful facility coming to serve the residents in need of short-term rehab care, at Claremont, just like we have a wonderful nursing home. So, I think we need to start. I think it's important we move forward. And we could talk about this for another 100 years too, like we talked about a lot of things but in any event, I do think that we need to move forward. And so when do we make a decision on this? Because I do think, with the opening coming up, and it being available to folks, hopefully by the end of January, we ought to get this out as soon as we can. So.
Okay. I think what we can do is we can summarize the issues. I think the whole issue of when, if we're going to do Comcast, when that should be these dates, or should we push it closer? I think we can get everything together into an easy decision-making package by early next week. One thing I did want to do to reinforce what Commissioner Eichenberger said is when I'm sitting there, when I go past Dickinson and Massey's, I'm sitting there at the corner of whatever that road is that leads you turn right under the trestle to go to the high school. Okay, I'm stuck there at that light. There's a digital billboard right in front of me, right before Pizza Grill. And within the 30 seconds that I'm stuck at that light, okay, I see 5 different advertisements. 3 of them were for healthcare facilities. But I love the Pinnacle one because what does it tell me? It tells me that they are nationally ranked in terms of limiting readmissions. So when Commissioner Eichelberger talks about our differentiator, okay, this is a lovely, lovely graphic, okay? It's a great graphic. But whatever we put up there has to very succinctly say what makes us different. And we've thrown out a bunch of stuff. I think what we need to do is if you're driving past that point, Holy Spirit, I said, it's all about, what is it? Hope in the right hands. Hope plus our science and our effect, that gives you good outcomes. That's the message, done eloquently, without graphs, without statistics. Clinical approach, the data shows lower readmissions, okay? They're all communicating very effectively in a very short window, very, I'm going to be gone down past the beer distribution if I make it past there, and gone out of sight of that billboard within 30 to 45 seconds of stopping at that stop sign. And that message has stuck with me in spite of everything else that's in there. So that's the approach we need to take in all forms of media that we choose to go on this. We need a succinct value statement, value proposition, differentiate. And I think we've got the right stuff to do, but we should definitely get that together. Yes.
I would offer too that initial design on that billboard, slide 14, if it is coming soon and that is January 15, should spell that out because the billboard will be down immediately after that opening, unless it is a campaign to continue on. But the coming soon is, okay, like when? Should I pay attention to this now? Or, yes, I need care, I'm having a knee replacement between Christmas and New Year's, I want to get on with it. Perhaps a more specific coming soon would identify that. If this is a limited campaign, not this is a long-term campaign for continuing to have this billboard, that's another scenario.
Our hope was to take this down as soon as it opens and get something more, specific to what we do up there. We were hesitant to put January 2015 because you never know in the construction world, could something come up that pushes us to February 2015 and then we are beyond what we've said when we be open. So we were hesitant. That's why we discussed a specific time frame, but we were hesitant to do it for that reason.
I don't think, we're not going to have issues with paint in the showers. That's strictly.
Well, even early 15 would be whatever. We can
Just bear in
elaborate on
mind,
that. So.
bear in mind, the outdoor companies, they will not take that board down until they sell it to the next client. So if you're in a high demand board, it will transition very promptly. If it's not, it can sit there for months.
So it needs to be durable.
Take time.
Okay. Any other questions or comments? I think we've had some good feedback. I think it is unfortunate we didn't have this discussion 2 months ago. But I think the feedback we got from people, we've got some decisions today. But I think it'll make whatever we do effective. And as we go forward with this, again, those referrals are not going to come as a result of doing open events. They're going to come as a result of ongoing, consistent work over time. And that 80-20 split that was mentioned is key. We've got to work directly with those referral resources and then surround it with stuff that reinforces it.
Speaking of that, do we have even an inkling of what an annualized budget would be for marketing?
We've been given a budget of $50,000.
That was courtesy of your chief clerk. We ran the numbers. It was 1/10 of the marginal revenue from the additional beds and revenues. Now, subject to change.
Well, I think you did a good start here, personally, and I want to thank you all and wish you all a happy Thanksgiving.
Yeah, thanks.